Pulmonary rehabilitation plays a very important role in the management of COPD patient because the quality of life and exercise tolerance is reduced in the patient. It consists of following components. First of all, we educate the patient about the condition, then focus on the generalized strength and the endurance training program, and the breathing patterns are retrained to increase the breathing of the patient, and the outcomes are assessed to whether check that exercise is beneficial or not. Nutritional advice, which is given by the nutritionist to increase the protein intake, and the psychological support is given to the patient. That exercise is helpful in improving the condition and reducing the severity of the disease. Chest physiotherapy, which is done by the respiratory therapist or physiotherapist to clear the or unplug the mucus, which is not cleared by the person itself by cupping. It consists of following techniques, which includes chest percussion, vibration, huffing, and positive expiratory pressure. Now, the conditions for which the chest physiotherapy is indicated or contraindicated, it is indicated in COPD, pneumonia, bronchiectasis, and cystic fibrosis. But in those in which intracranial pressure is elevated and in those rib fracture and vertebral fracture is diagnosed, in those patients who are osteoporotic, it is contraindicated. Before going to start chest physiotherapy, we assess the patient for the vital signs in which we assess the BP, heart rate, and oxygen saturation level. We assess for the contraindication, and we have a complete physical examination of the chest in which we have to rule out any open wound and the bleeding from the wound. And at the last but not the least, we review the chest x-ray and the blood test of the patient.